How do you establish rapport and build trust with pediatric patients and their families?
To establish rapport and build trust with pediatric patients and their families, I begin by creating a warm and welcoming environment. Children are often understandably anxious in medical settings, so I focus on making them feel safe and comfortable from the outset. I introduce myself to both the child and the parents, clearly explaining my role and what they can expect from me. I make an effort to communicate at the child's level, using simple language, maintaining eye contact, and often engaging in light-hearted conversation to make the experience less intimidating. With very young children, I may get down to their eye level and use toys or games to help them feel more at ease. For parents, I understand that trusting someone with their child's health is a significant step, so I listen attentively to their concerns and acknowledge their observations and questions. This openness not only reassures them but also helps me gain valuable insights into their child's needs and behaviors. I also ensure that they are informed every step of the way regarding treatments, procedures, and any follow-up care that might be needed. By fostering open communication and demonstrating respect for their role in their child's health, I work to build a collaborative relationship with both the child and the parents. In addition to building an initial connection, I make an ongoing effort to engage pediatric patients and their families through frequent and open communication. For example, during every shift, I check in with both the child and the parents, not only to update them on the care plan but also to see how they are feeling emotionally. Often, children experience mood swings or changes in behavior due to hospitalization, and maintaining regular contact allows me to address these issues as they arise. By consistently being present and approachable, I build a foundation of trust that reassures both the child and their family members. This open-door approach makes it easier for families to share even minor concerns, allowing us to address any discomforts or anxieties promptly. Another aspect of building rapport with pediatric patients involves collaborating with child life specialists or therapists, if available. For instance, if a child is particularly fearful of medical equipment, I might work with a specialist to use play therapy or other strategies to help the child understand and become comfortable with their environment. I find that integrating these specialists into the care process enhances the child's comfort and helps families feel that we are taking a holistic approach to their child's well-being. Over time, these consistent, compassionate efforts contribute to a trusting and reassuring experience for the family, even in challenging situations.
Can you describe a challenging situation you faced in a pediatric setting and how you handled it?
One challenging situation I faced involved a young patient who had been diagnosed with leukemia. Understandably, both the patient and her parents were overwhelmed, frightened, and resistant to treatment at times due to the painful side effects and emotional toll. Initially, the child was especially hesitant to undergo regular blood draws and chemotherapy sessions. To address this, I took the time to build rapport and gain her trust by incorporating small but meaningful actions, like bringing her a favorite book to read or letting her hold a comfort item from home during procedures. I also worked closely with the child life specialist to introduce age-appropriate explanations and play therapy to help her understand the treatment process and reduce her fear. For the parents, I made myself available to answer questions, provide updates, and offer emotional support as needed. I encouraged them to take short breaks for self-care and assured them that their daughter would be in caring hands during those times. Eventually, with a combination of compassionate care and open communication, the child's anxiety lessened, and she became more cooperative with treatments. The experience taught me the importance of individualized care, patience, and the power of empathy, which were crucial in helping both the child and her family cope with such a difficult time. Following the initial rapport-building efforts with the young leukemia patient and her family, I encountered additional challenges as her treatment progressed. Chemotherapy took a toll on her physically and emotionally, often leaving her exhausted, nauseated, and understandably irritable. One of the main challenges was managing her distress during painful procedures like blood draws. To help ease her anxiety, I coordinated closely with a child life specialist to introduce a comfort protocol tailored to her needs, including allowing her to pick out a comfort item before each session and implementing calming breathing exercises that she could practice during procedures. This small routine gave her a sense of control and became something she could anticipate and rely on. Throughout the treatment process, I remained committed to supporting the family emotionally, frequently checking in with her parents to provide updates and reassurance. I encouraged them to celebrate small victories and helped them find support groups with other families facing similar diagnoses, which gave them an additional support system. These actions reinforced the family's trust and confidence in the medical team. Reflecting on this experience, I learned the power of empathy, patience, and individualized care, which are essential in overcoming even the most challenging situations in pediatric nursing.
How do you adapt your communication style to different age groups of pediatric patients?
Adapting my communication style to suit different age groups is essential in pediatric nursing, as each developmental stage has unique needs and ways of understanding the world. For infants and toddlers, nonverbal communication is key, so I focus on a calm and soothing tone and use gentle touch and facial expressions to comfort them. I also involve the parents directly in any care, as this age group is highly dependent on familiar caregivers for reassurance. For preschool-aged children, I use simple language and often incorporate storytelling or toys to explain what is happening. For example, I might tell them that a blood pressure cuff is a hug machine to help them feel less afraid. School-age children generally respond well to more direct explanations, so I provide simple but clear information, using analogies they can relate to, and I give them small choices when possible, such as which arm they prefer for an injection. With adolescents, I find that respect and transparency are crucial. I explain procedures fully, address their questions directly, and ensure their privacy and dignity are maintained. I am mindful to treat them as partners in their care, giving them space to voice their thoughts and concerns. Overall, adjusting my communication style according to age and developmental level helps to reduce anxiety and establish trust, making pediatric care more effective and compassionate. Beyond simply modifying language and approach, adapting my communication style also involves being mindful of cultural and individual differences among pediatric patients and families. Each child brings a unique personality and background, so I take time to observe and listen to how they communicate, which helps me tailor my interactions further. For instance, some children are naturally shy and may need extra reassurance, while others are more outspoken and comfortable expressing their needs. Recognizing and responding to these nuances helps build a trusting relationship, as it shows the child and their family that I am attentive to their specific needs. Additionally, I make sure that my communication style is flexible enough to adapt in real time based on the child's immediate emotional state. Hospitalization is a stressful experience, and a child who is cheerful and communicative one day might be withdrawn or upset the next. I adjust my approach accordingly, sometimes taking a quieter, more supportive stance when a child feels overwhelmed or offering a bit of humor or distraction when I sense they need a lift. My goal is to meet children where they are emotionally, ensuring that they feel understood and respected at every stage of their hospital journey.
What is your experience with administering medications to pediatric patients, including infants and children?
Administering medications to pediatric patients, including infants and children, requires a high degree of precision and attention to detail. I have considerable experience in ensuring accurate dosages, calculating medication based on body weight, and adjusting administration techniques based on the child's age. With infants, I am particularly careful with oral medications, using specialized syringes to control doses and prevent choking. For slightly older children, I might use flavored medicine or even minor distractions to make the experience smoother. In cases of intravenous medications, I take every precaution to ensure the child is calm and comfortable, using tools like EMLA cream to numb the area or distracting the child with a toy or story. I also explain to parents what I'm doing and why, as many of them worry about the administration of medication and appreciate knowing that their child is safe. Safety protocols, such as double-checking dosages and closely monitoring the patient after administration, are a part of every medication-related task I perform to prevent any adverse effects or reactions. When administering medications to pediatric patients, I am meticulous about following the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time, particularly since children's dosages are sensitive to even slight variations. For example, pediatric dosages are often calculated based on body weight or surface area, so I double-check these calculations, especially in cases where the patient has unique needs or conditions. I also involve pharmacists in cases where medication interactions are a concern, ensuring that the safety and effectiveness of treatment are upheld. I also prioritize comfort and understanding when administering medications to pediatric patients. Before each medication is administered, I explain to older children what the medication is for, why it's necessary, and what sensations they might feel. This proactive communication helps to reduce their anxiety and makes the experience more predictable. For younger patients, I might use toys, music, or other distractions to ease the process. By combining precision with empathy, I help create a safe and comforting environment for medication administration, ensuring that children feel secure and understood throughout the experience.
How do you assess pain and discomfort in pediatric patients, especially in nonverbal children?
Assessing pain and discomfort in pediatric patients, particularly in nonverbal children, involves careful observation and sensitivity to nonverbal cues. I rely on pain assessment tools, such as the FLAC scale, which evaluates the child's facial expression, leg movement, activity, crying, and consolability to determine their level of discomfort. Observing behavioral changes, such as irritability, restlessness, or a change in eating and sleeping patterns, can also indicate pain in infants and young children. In addition to using these tools, I work closely with parents, as they often have valuable insights into their child's behavior and can distinguish between normal and pain-related responses. I encourage them to let me know about any small signs that might indicate discomfort, and I integrate their observations with my own assessments. This comprehensive approach helps me identify pain more accurately and provide timely and effective interventions. While using standardized pain assessment tools like the FLAC scale, I pay close attention to subtle signs that might indicate pain in nonverbal children. For instance, changes in breathing patterns, skin color, and muscle tension can reveal discomfort. Similarly, behavioral cues, such as clinging to a caregiver, becoming withdrawn, or refusing to eat, often signal that the child may be experiencing pain or distress. By continuously observing these physical and behavioral indicators, I can adjust care interventions to manage pain more effectively. In cases where children have chronic or complex conditions that require long-term pain management, I collaborate with pediatric pain specialists and incorporate multimodal pain management techniques. This might include the use of non-pharmacological methods like positioning adjustments, heat or cold packs, and even age-appropriate relaxation techniques. I also make sure to involve the family, as their insights are invaluable for recognizing early signs of discomfort. This holistic approach enables me to address pain in a way that is both responsive and respectful of each child's unique needs.
How do you handle emergency situations, such as pediatric cardiac arrests or respiratory distress?
In emergency situations like pediatric cardiac arrests or respiratory distress, my primary focus is on remaining calm, following protocol, and collaborating effectively with the healthcare team. I am trained in Pediatric Advanced Life Support, PALS, and during a cardiac arrest, I immediately start CPR and ensure that emergency equipment, such as defibrillators and airway devices, are on hand. I closely monitor the child's vital signs, administer medications as needed, and maintain clear communication with other team members to ensure a coordinated response. Additionally, I provide updates to the child's family with as much sensitivity as possible, recognizing that their emotional needs are significant during such a traumatic time. My experience in pediatric emergency response has taught me the importance of preparation, vigilance, and teamwork to deliver the best possible outcome in these critical moments. In high-stakes emergencies like pediatric cardiac arrests or respiratory distress, maintaining composure and acting decisively are essential. I begin by immediately assessing the child's airway, breathing, and circulation, initiating CPR if necessary, and calling for additional support. My training in Pediatric Advanced Life Support, PALS, and experience with pediatric resuscitation have prepared me to act swiftly and follow protocol under pressure, ensuring that the child receives life-saving interventions as quickly as possible. Communication is also critical during emergencies. I ensure that other team members are aware of what steps are being taken and any changes in the child's condition, which fosters a coordinated and efficient response. After stabilizing the patient, I also take time to support the family, providing updates on the child's status and explaining the steps we are taking to address the emergency. This sensitivity to both the medical and emotional aspects of emergency care is crucial for providing comprehensive support in high-stress situations.
What is your experience with common pediatric procedures, such as venipuncture and immunizations?
I am highly experienced in performing pediatric procedures like venipuncture and immunizations. With venipuncture, I use age-appropriate techniques to help children feel more comfortable, such as using smaller needles and distraction methods, or even applying numbing cream beforehand. I explain the procedure in simple terms, and for young children, I might use comforting words or play techniques to reduce their anxiety. For immunizations, I focus on building trust by explaining why the vaccination is important, especially with older children who may have questions or concerns. I am also sensitive to their fears, offering reassurance and, if possible, a reward or sticker afterward to help create a positive experience. By combining skill with empathy, I strive to make these procedures as painless and positive as possible for my young patients. Beyond the basic technical skills required for procedures like venipuncture and immunizations, I am mindful of the emotional and psychological impact these procedures can have on children. Before performing venipuncture, I carefully explain the procedure in age-appropriate language and offer choices where possible, such as which arm they'd prefer for the needle. I also use distraction techniques, like storytelling or asking the child to describe their favorite activity, to keep their focus away from the needle. My goal is to make the procedure as stress-free as possible, helping children feel a sense of control and minimizing any fear associated with the process. I also understand that the parents' reactions to these procedures can influence the child's experience. I reassure parents, answer any questions they have, and offer them the option to stay with the child or take a short break, depending on what they feel most comfortable with. This holistic approach not only makes the procedures more manageable for the child but also supports the family as a whole, creating a caring environment that acknowledges both physical and emotional needs.
How do you ensure a safe and comforting environment for pediatric patients during hospitalization?
Creating a safe and comforting environment for hospitalized pediatric patients is a priority, as the unfamiliarity of the hospital can be overwhelming for them. I focus on maintaining a calm, clean, and child-friendly atmosphere. This may include arranging toys or familiar items from home within reach, ensuring that rooms are welcoming with child-friendly decor, and involving the child life team to provide age-appropriate activities and emotional support. Safety is another crucial component, so I adhere strictly to hospital protocols for infection control, check that beds and equipment are child-safe, and monitor any potential hazards in the environment. I regularly check in with both the child and their family, addressing any concerns they may have, and I make it a point to be approachable and present. By creating an environment that is both physically safe and emotionally supportive, I aim to help children feel more secure and relaxed during their hospital stay. Moreover, to creating a welcoming physical environment, I work with the Child Life team to provide children with familiar, comforting activities, such as reading, coloring, or age-appropriate games. These activities not only keep children occupied but also allow them to express themselves creatively, helping them cope with the stress of hospitalization. I also encourage parents to bring in familiar items from home, like blankets, toys, or favorite books, to help children feel more at ease. Beyond emotional comfort, I am vigilant about physical safety, ensuring all equipment in the room is child-safe and regularly inspected. For example, I check 4 lines, monitor alarms, and ensure that medication storage is secure, minimizing any risk of accidental injury or tampering. I also educate families on how to create a safe environment within the hospital room and during any interactions with other patients. This attention to detail reinforces a sense of security, making the hospital environment as safe and nurturing as possible for young patients.
What is your experience with providing developmental care and education to families of pediatric patients?
Providing developmental care and education to families of pediatric patients is essential for promoting a child's health and well-being, especially for those with chronic conditions. I work with families to understand their child's developmental milestones, offering guidance on age-appropriate activities that support both physical and cognitive development. For example, I may advise parents of infants to incorporate sensory play to stimulate their child's development or guide parents of school-aged children on ways to support social skills if their child has been isolated due to illness. I also provide education on managing specific health conditions, whether it involves daily medication, physical therapy, or dietary adjustments. I ensure that families understand the treatment plan and feel empowered to continue care at home. By building a relationship with families, I help them feel supported and capable, which contributes positively to their child's recovery and overall development. Apart from supporting parents with general developmental milestones, I often work with families to create individualized developmental plans for children with specific health conditions. For example, if a child has been diagnosed with a condition affecting their motor skills, I may work with physical therapists to show parents exercises that they can do with their child at home to support developmental progress. This collaboration helps parents feel empowered and ensures that children continue to develop even while managing a health condition. I also recognize that some parents may feel overwhelmed by the educational information provided, especially if they're navigating a new diagnosis. I make it a point to provide materials in accessible formats, such as brochures, digital resources, or videos, and I encourage them to reach out if they have any questions. I find that when families feel supported and confident in their role, the child's development and overall health outcomes improve significantly. My goal is to be both a caregiver and an educator, helping families feel prepared and hopeful about their child's growth and future.
How do you stay updated on the latest advancements in pediatric nursing and child development?
To stay current with advancements in pediatric nursing and child development, I regularly attend seminars, conferences, and workshops focused on new practices and research in pediatric care. I am an active member of several professional nursing organizations that provide resources and continuing education opportunities specific to pediatrics. Additionally, I subscribe to peer-reviewed journals and online courses that cover emerging treatments, technologies, and best practices in pediatric nursing. I also find it valuable to participate in multidisciplinary team meetings where healthcare professionals from various fields share insights and updates, as this allows me to learn from colleagues and incorporate a range of perspectives into my practice. By staying engaged with ongoing education, I ensure that I am prepared to offer the highest standard of care to my pediatric patients. In addition to formal continuing education, I participate in journal clubs and peer study groups within my hospital or professional network. These clubs often focus on recent research articles in pediatric nursing and child development, allowing me to engage in discussions with other healthcare professionals and understand various interpretations and applications of new research. By analyzing current studies with my peers, I gain deeper insights and learn practical applications that I can integrate into my own practice. I also attend pediatric nursing conferences when possible, as these gatherings allow me to hear directly from leading experts in the field and participate in hands-on workshops. These experiences not only keep me informed about innovations in pediatric care but also enable me to connect with other professionals and build a network of resources that I can draw upon. This commitment to ongoing education ensures that my skills and knowledge remain relevant, benefiting both my patients and their families through evidence-based, current, and compassionate care.